Hello and welcome everyone to this session on atrial fibrillation, and we are going to see the very basics of atrial fibrillation. Till now, I think you all only know like 1 or 2 points about AFib. So I would like to know, no need to unmute yourselves. You all can write in the chat box that what is it that you all know about atrial fibrillation? When I say these words AFib, what exactly comes to your mind? Anything? Manya, can you tell me what comes to your mind? Nidhi, Anusha, you all must have thought of something, right? Okay. Anusha is saying it's a type of arrhythmia. All right. So, Anusha, if it's an arrhythmia, can you tell me, is it an atrial arrhythmia? Is it occurring in the atria or is it occurring in the ventricle? So, can I call it as an atrial or ventricular arrhythmia? Very good. Atrial. Okay. Is there any other word that we use for the term atrial arrhythmia? Anything else that we use for the term atrial arrhythmia? Atria are above the ventricles, correct? So we also call it as supraventricular arrhythmia. Okay, supraventricular arrhythmia. All right. Saloni has very well mentioned that the heart rate is 300 to 400 beats per minute. Not exactly. We'll come to that in some time. But she has mentioned one very important point that the heart rate is irregular. Yes, in atrial fibrillation, the heart rate is irregular. Now, from the ECG that you see over here, can anyone calculate the heart rate and tell me? I remember I have taken a class on ECG for you all in the practical batch. So in that, I had taught you all how to calculate the heart rate if you are having an irregular rhythm, correct? So here, as you can see, the RR interval is not constant. The RR interval is constantly changing. Can you tell me what is the heart rate over here? Anyone can calculate and tell me, or you all have forgotten how to calculate heart rate in irregular rhythm? Of course, we will discuss that also today, but let me see if anyone remembers. Anyone remembers? Any guesses? Okay, no one knows. All right, no problem. So, no, the heart rate is not 200 per me. Very good, Akshaya. It is 120. That's absolutely correct. And how did Akshaya come to 120? We will see ahead. All right, but that's absolutely right. Okay, so let's start off with what exactly is atrial fibrillation. Now, when you get this question in your exam, these are some of the subheadings under which you will write your answer. Okay, so first is, what does atrial fibrillation mean? What are its causes? What is the etiology of the same? What are the symptoms, complication, diagnosis, and treatment? Very simple. All right. Okay, so what does atrial fibrillation mean? I want you guys to understand what is the difference between coordinated and uncoordinated. Okay. So whenever you do anything in coordination, like when you dance in coordination, everything, your mind and your body is in sync. This is the kind of dance that you get. This is called as a coordinated dance. Okay. So this is ballet. Versus when your mind body is not in sync and you're doing any kind of uncoordinated movements, what is the kind of dance that you will get? This is the kind of dance that you will get. Okay, so that was ballet, and this is famously called as Nagin dance. All right. So this is the same thing that is happening in the atria also. We have coordinated as well as uncoordinated activity. When we have coordinated activity, that is normal heart. Okay, so you have normal atria which are giving the signals, and then the ventricles and atria are contracting in a coordinated manner. But when everything is chaotic, when everything is messy, what happens in the atria? What you get in the atria is something similar to a Nagin dance. All right. Okay, so let's have a look at what exactly happens. Now, I'm just going to stop sharing with you all because I want to write. Now, let's ask someone who's here. Krishika. Krishika, can you tell me that what is the normal electrical activity that happens in the heart? How does it start? Normal electrical activity. How does it start? Where does it go? What happens?
Ma'am, it starts in the sinoatrial node, which is the
Where
pacemaker
is
of
the
the heart.
sinoatrial node located?
It is in the right atrium.
Very good. So it is the pacemaker of the heart. So it gives the first impulse. Then what happens?
Then it spreads to other cells of the heart. So it covers the atria first, and then it goes through the AV node, and then
Oh,
through the bundle of his, the Purkinje fibers,
hmm.
and then it goes to the ventricles.
Absolutely. So let's have a look at what she was trying to say. Well done, Krishika. So this is the SA node. The SA node is often called as the pacemaker of the heart. Okay, so the SA node fires an electrical impulse. Now this electrical impulse goes through the normal atrial cells in the right atrium. Then it crosses over from the interatrial septum to the left side, left atrium. Okay, and while it goes to the different parts of the atrium, it will basically activate these atria. Okay, now it goes everywhere in the atria. Now when it activates the atria at one period of time, both the atria, left and right atrium, both are activated, and there is a coordinated contraction of the atria. Okay, so when the atria contract, what happens? The blood that is there in the atria is pushed down through the valves into the ventricles. Okay, now at the same time, there are some electrical impulses from the SA node that also go to a specialized node that is present over here, which is called as the AV node. Okay, so the AV node receives the electrical impulse. From the AV node, the electrical impulse passes off to the bundle of His. We all know that. Okay, from the bundle of His, you have the Purkinje fibers. Sorry, you have the bundle branches. Okay, so you have the left and right bundle branches. So this signal is traveling through the bundle of His, through the bundle branches into left and right side. And then from this specialized conducting tissue, this signal goes to the ventricles through the Purkinje fibers. Okay. So now what has happened? This whole thing happens very quickly, all right, literally in seconds. So as a result of this, when the Purkinje fibers receive the impulse, they will basically go and spread the impulse throughout both the ventricles. Both the ventricles get activated and both the ventricles contract. That is called as the ventricular contraction. Okay, so that is coordinated activity of the heart that is happening. So atria will contract. After that, the electrical impulse will spread to the ventricles, then the ventricles will contract. Atria contract, ventricle contract, atria contract, ventricle contract. While one contracts, the other relaxes. Okay, so this is how we have the entire heart functioning. What happens in case of atrial fibrillation? In case of atrial fibrillation, basically your atria that are there are structurally damaged. Okay, so we have two types of cells that are there in our heart. One is the specialized conducting tissue. Specialized conducting tissue. So can you guys tell me, in the specialized conducting tissue, which parts of the heart will come? We just discussed it, through which all the impulses pass very quickly. Can you write in the chat box, anyone? Which are the specialized conducting tissues? So it is basically SA node, AV node, your bundle of His, your bundle branches, Purkinje fibers. All these are the specialized conducting tissue of the heart. Okay. Versus you have the normal tissue in the heart. What is the normal tissue in the heart? So your normal atrial myocytes. I will write it over here. Your normal atrial myocytes. Why myocytes? Because these are nothing but muscle cells. And your normal ventricular myocytes, they make up for the remaining part of the cells of the heart. Okay, so what is there over here? This is a normal atrial myocyte. What is there over here? Normal atrial myocyte. What is there over here? Normal atrial myocyte. But if you see what is there over here, this is a specialized conducting tissue.